Well, as we wrap up Pharmacist Appreciation Week, we dive into what it takes to become a pharmacist and the reasons behind the shortage of candidates.
Senior health correspondent Monica Robbins takes us to one of 7 Ohio pharmacy schools to talk to tomorrow's pharmacists.
Third-year pharmacy student Tailyn Houston has no intention of working in a drugstore after graduation.
I'm still figuring it out, but I have a strong interest in infectious disease, solid organ transplant, and neuropsychs.
She and her classmates have dozens of opportunities to choose from.
Anything that a doctor can specialize in, a pharmacist can specialize in.
Houston is witnessing the next generation of medicine develop.
There's the field of pharmacogenomics that's kind of coming to the forefront, where they test your genetics and see what medication would be right for you based on those the results of that. So that's really helping with personalizing the medicine for each person.
Neomed College of Pharmacy is one of 7 pharmacy schools in Ohio. Olivia King graduates this spring. Her dream job is an independent pharmacy with direct patient care.
Hopefully pharmacists get provider status and be able to both prescribe and manage medications and then also dispense them to the patient right there.
Ohio pharmacists have provider status for Medicaid, but not Medicare or commercial insurance. A pharmacist shortage may prompt a change.
I think it's going to change because of all of the chains that are closing. Independents are closing left and right as well. So we're going to run into a pharmacy desert where it's going to be hard for people to get their prescriptions, which is really, really sad.
As of now, fewer pharmacists are entering the field.
When we were at our peak for a number of pharmacists that were graduating each year is around 14 to 15,000. Right now, we'll be graduating a class size of around 9,000. So there's been a dramatic decrease.
Despite chain stores closing, it's surprising for a field with so many other job opportunities and lucrative salaries.
Average salary is usually $120,000 to $130,000.
And it's a career that can be started in high school.
You really only need 2 years of prerequisite coursework before you start your PharmD program. So you can have your doctorate degree in 6 years out of high school.
Yeah, do you believe that? When we say high school, we're referring to kids who are already taking college classes in high school. So those who are exceptional in chemistry, biology, and other sciences are ahead of the game. You don't need a bachelor's degree to go to pharmacy school. If you have 2 years of college prerequisite work, you can start, and it also doesn't hurt to have a job as a pharmacy technician in a drugstore, because now the chains are starting to offer up scholarships.
Oh, to help you get through school.
To help you get through school. So,
okay.
Yeah, but it's a 4-year college to go through, just like a medical school.
Sure.
So, yeah, and yes, it is a doctorate in pharmacy.
And the responsibility that those folks take on, like when you say thanks, you better mean thank you, because you think about all the chemistry that a little bit of this and a little bit of that.
They better get it right.
Throw your system off completely.
And it's more than just the folks behind the counter at your local drugstore. These are the people who are making the drugs that you take. I mean, that's just one job they could do. So, I mean, when I say there are hundreds of different jobs that a pharmacist degree or a pharmacy degree you can get into, we're not kidding. There are so many different aspects of this career that these folks can get into. And yes, provider status is key. So a pharmacist can now, in Ohio, can enroll and become a Medicaid provider, but right now they can't provide medication for Medicare or commercial insurance. But because of the shortage, don't be surprised if that
might change.
Yeah,
it's interesting. And also, when you offer a 6-figure salary like that to start, that is also a nice enticement to make sure that we bridge the gap from shortage to having enough.
If you're looking for a degree,
there you go.
There's something to look for.
Hopefully you're good at chemistry too.
Yeah.
Great. Thanks so much, Monica.
Sure.